Welcome to Added Beauty. I'm Dana. Let's talk about it. Today is Monday. This is going to be video 21. I'm doing a sprint. I'm trying to get to 100 videos. And today's going to be a little different because I want to talk about my doctor visit. So you guys know that I am working on my own health. I'm working on getting through menopause without having, 15,000 hot flashes a day. Working on functional nutrition, functional medicine, and it also goes along with the things that I am learning at school. So I'm in my doctoral program for whole health, and that is all about, wellness as opposed to a sick model and preventative things, and using complementary and alternative medicine options to not have to rely so much on pills and surgeries and things, right? And also taking into account the whole person, like their spirit, their mental health, their physical health, their culture, their community, their socioeconomics, all the things. So that you have the patient working with you to self-determine what feels like health for them, what looks like health for them, and as opposed to going to their doctor or provider and the doctor just saying, now you do this, now you take this, now you need this surgery. Instead, it being more of what feels good to you. Let's talk about what I think you need. Let me hear what you think you need. Let's figure out how we can work this together to get you the best outcome, right? So that's what I'm studying, but that's also what I'm pursuing for my own health, right? And I have been up and down. So I had a hysterectomy in the middle of 2022. I had maybe it's TMI, but we're women, right? Let's talk about it. We're probably, if you're watching this, you probably might be close in age to me too. Maybe not. Maybe you want to learn for the future. And what I can say for those of you who are not in menopause yet is 100% do not recommend. It sucks. But I mean, okay, whatever. What can you do? So, there's also all this data about the fact that it sucks even harder for Black women, which, we need another thing, right? But where, let's say, an average white woman might be in menopause for 5 to 6 years, there's all this data that says that Black women can be in menopause for 10 to 12. And I was like, okay, I'm not gonna sweat my behind off for 10 to 12 years. We ain't doing this. And so the last couple of few years have been interesting. Some periods of time wasn't so bad. Some periods of time it was hellacious. Some periods of time it's been up and down. And I talked to other people about it, and they said similar things, like it's not all one way or the other, but generally when you're having the symptoms, it's not a good thing. So different people recommend things. I've tried black cohosh. I've tried, a girlfriend of mine recommended these drops that was like a combination of a few different herbs that had some black cohosh in it too. I've tried other supplements and things, and it might be helping a little bit, but it wasn't helping enough to be really significant. And so I was like, all right, I just gotta go in and talk to the doctor and see what's going on. And I wanted to hear about hormone replacement therapy specifically because what I do know is that in the last few years, the thought about it, the information out there has changed. There's been additional studies, and whereas people used to be afraid to take some hormone replacement therapy based on a study that happened 24, I think it was 2002, so what did we 20, so 24 years ago, had everybody going, oh my god, I can't, it's gonna make me get cancer. And in particular, Black women for whatever reason, were less likely to be offered alternative things and or kind of have the hormone replacement therapy discussed with them. But in the last 2 to 3 years, there was a study that came out that showed a whole different whole different ball game. So they figured out different formulations, first of all, that use less progesterone, and that helped with some of the cancer concern. Well, let me back up too. So you guys know, or most of you probably know, that we all have all the hormones in our body, whether we're male or female. This is not about whether you're he or she or they or them or what, any of that kind of sexual identity thing. It's just biology. Men have progesterone and estrogen like women have testosterone in different doses. And in fact, there was even is that on my eye? What is that on my eye? I don't know, something going on. Okay, that's my hair. I can see my face on videotape, and I'm like, what the heck is that? And no, I'm not editing that out. Anyway, so yeah, there was even like studies. I remember I was at UCLA undergrad years ago when I took a psychobiology class, and the professor was talking about how they had been doing studies trying to figure out what was the cause of homosexuality. And they had determined that they felt that in men, it was a hormonal imbalance, and that they had more of certain, female hormones at different levels of the, Kinsey spectrum, I guess, or whatever. And that they thought that was what explained why some men that are gay seem to be more effeminate or not. But interestingly, at that time anyway, they said they had not figured out the hormonal connection for women who were gay. And so I was like, all right, whatever. I'm in the class. I'm like, 19 and listening, and fast forward all these years later. And the way that all of the different things are framed is completely different anyway, but they do seem to think there's some hormonal relations to a lot of things, and hormones control so many things. And so anyway, back to the menopause of it all. When I was looking into it myself and talking to folks, GYN docs and even endocrinology people are like, yeah, no, it's pretty safe now. And yeah, the studies have actually shown that it does not have a higher risk of causing cancer, especially in women who started under 60. And yeah, I'm under 60. So way under, but still. And so my appointment was finally today. And while I was talking with the doctor, go over your whole history and all the things to make sure you could be an okay candidate for it. And one of the things that he mentioned was that now the studies actually say that taking some of these hormone replacement therapies can actually reduce the risk of certain cancers, reduce the risk of dementia in some cases, reduce some cardiovascular risk. And I thought that was really, really interesting. It's like a total 180, but with, evidence-based reasons and, all of those things. And so it's a combination of better research, better understanding. I think the study that was being done back in 2002 was stopped abruptly when they thought it was causing something bad. And so they didn't get a full picture, but also, things have evolved in 22, 24 years. So there's pills, there's creams that you can put, vaginally. There's also creams that can be offered to help with, like if you are having symptoms of dryness or itchiness or all kinds of things. And there's injections. And then there's these pellets. So, generally it seems like the pills are going to be covered by insurance. but he talked to me about pellets, and that was a more bioavailable, I guess what he was trying to say is it was non-synthetic hormone. So they do a study, some lab work for you to determine exactly what your hormonal imbalance may be, and then they do a compounding of whatever is going to go in this pellet for you that would be the perfect match to balance you out with what your specific issue is. So of course that sounded interesting to me for a couple of reasons. One, because it's not synthetic, and two, because it would be something that's formulated for me. Of course, the drawbacks of that are it's not generally covered by insurance, that version, and also not fully, some of it is and some of it isn't, not fully FDA approved. But something being fully FDA approved or not does not mean that it's not safe. In general, the FDA is years and sometimes decades behind other countries in what they approve or don't approve, and there's reasons for that. And of course, they all are financial for the most part, because it's not to say that other countries don't have as rigorous of, a study and investigatory situation in their clinical trials and whatnot, but they seem to get through them in shorter order in some cases, and for whatever various reasons they go along with big pharma and other things here, sometimes the clinical trials take longer. So I'm going to do some more investigation, and in the meantime I think I'm going to start on the estrogen pill that is covered by my insurance, so I can just at least start the process. And then while I continue to look into the non-synthetic hormonal compounded version and see, if I want to do that. This doctor quoted me about $150 a month that would cost me. But like I said before, mama likes a deal too. And I don't want to deal, bargain basement my health, but sometimes things are different prices from different vendors. Even some of these GLP-1s, right? So say, for example, a lot of insurance companies, and including Medicare, stopped paying for GLP-1s at the first of this year. So now, people who were on it, if they wanted to stay on it, they'd have to figure out cash pay, or in some cases you can appeal to your insurance if you have certain health conditions, like a fatty liver or a couple of other things that may allow you to stay on your GLP-1s. But if it was just for weight loss, then they're probably not going to pay for it. But if you can't appeal and successfully get it reinstated, then there's a lot of different companies now that are just selling it, even Costco. So I learned recently that Costco has a decent deal on that as compared to some other companies that sell it, just FYI. And I'm not on GLP-1s, but in doing the research, we learned this. And so all that to say, I'm going to look around and see what other vendors are charging. This is the first, GYN that I've talked to about it, and I'm going to find out what else I can learn. But I do think it's interesting to note that not only, like, the whole party line has changed across all of the doctors. This is not this one doctor saying this. Based off of the research that's happened in the last however many years, 5 years or so, the new party line is hormone replacement therapy is safe. Not only is it safe, it could help prevent certain illnesses, and that includes certain cancers, whereas previously people were being told not to take it because it could cause cancer. And the fact that it could help with potentially heart issues, potentially dementia. You know, that brain fog you feel when you are going through menopause and you're like, oh, some of that is hormonal, a lot of it is, but if it drops off too hard, they're saying that there's that hormonal link as to why there are sometimes more women who have Alzheimer's than men. So I'm definitely going to take the hormones. And, you know, I went over all the side effects with the doc, and I'll watch for them and everything, but it seems like it's palatable, probably not more than any other side effects you'd have from anything else, but that the benefits would, for me anyway, and I'm not giving medical advice, that the benefits would outweigh the negatives, just for generalized information's sake. Also, before, you know, while you're getting on it, the doctor will ask you to go have a bone density scan. And that's to get a baseline to make sure that you're not having any, you know, bone demineralization as relates to taking the medicine. They'll also ask you to have a pap smear, which you should be doing annually anyway, or at least every other year. And they will ask you to have a mammogram. And all of these things are to establish a baseline, so that you can track and they can track and say, yeah, everything's fine, nothing's changed, everything's good. And, you know, if for some reason it wasn't, then they can see the difference. So I'm excited about the possibility. And, you know, after I've been on it for a while, I'll do another video and tell you if it's helping or not helping. But I think, let me see if I can pull it up really quickly. I have my laptop sitting right here. So, what did they say? There's less risk of, one of the other things that people had been worried about before was blood clots, that there's less risk of that as well, because the way that the medication is delivered now, it doesn't go through your liver, so also doesn't tax your liver, and it reduces, and the dosage of the progesterone is reduced, so it reduces the risk of any kind of blood clot that could be a concern, and it also reduces the risk of breast cancer. Well, not reduces, they're saying there, I'm quoting now, when women take estrogen combined with natural micronized progesterone, which, you know, low dose progesterone, there's no increased risk of breast cancer thus far observed from their studies. And that's huge. That's huge. There's also some stats about that 30 different clinical trials found that women, that's a lot of trials. 30 trials is a lot. So it's kind of like a metadata kind of thing that said that women who began hormone therapy before age 60 had a 39% lower risk of death than women who didn't take the hormones. And they're showing that the benefits outweigh the risk for younger women with menopause symptoms. So, yeah, they're saying specifically women who started hormone therapy in early menopause tended to live longer than women who didn't take the hormones. Yeah. So, and this is like in Journal of Medicine, and which one is this one? I'll tell you exactly in case you want to do your own studying. So there's multiple different references that you can look at, and it's all found online. You can find it now too. But yeah, I'm going to take the estrogen, and then I'm going to look into that bioidentical hormone therapy, and I'll let you know what I find out about that too. So hopefully pretty soon you won't see me like, you know, glistening too hard anymore, or sweating as hard, and unless I'm working out or unless I'm trying to build up a sweat. But it's good. I was waiting for it. I'm excited about it, and I'd love to know what you think about hormone replacement therapy, if you've tried it, if you've had thoughts about trying it, if you've been nervous about trying it, if you know anybody who's been on it, like what do you know? How do you feel? And is it making your life better? Is it making your life more beautiful? Is it allowing you to get back to just doing you without having to live working around that? I want to know, and I'll keep you posted too. Let's pause here for today and talk again tomorrow, okay? I hope that you had a wonderful Monday, great start to your week. Don't let people get you too stressed out. Remember who you are, remember whose you are. And yeah, good start to February. I think it's gonna be big doings this month. I hope so, anyway. And let's assume the best. Let's assume it's gonna be good and then work towards that. So, all right, let's take our deep breath. And one more. Remember that rest is medicine, and you deserve to relax. All right, this is Added Beauty. I'm Dana. I'll see you tomorrow. I hope you like and subscribe. Tell a friend, tap a neighbor, tell a friend, and I'll see you tomorrow.